Well, taking a break from cooking for just a minute to talk about something that affects a lot of people, and that is back pain. It is so common, and you know what? There is something that might work for you. And here to talk a little bit about it is Dr. Randall Johnson with the Neuroscience Group. Good morning.
All right, good morning.
Boy, we've come a long way when it comes to helping with that back pain. We're going to talk a little bit about spinal fusion. What is that exactly?
Well, spinal fusion is essentially fixing together the bones of the spine in an effort to treat intractable spine pain. In other words, pain that hasn't responded to other forms of treatment.
And does it work really well?
It works pretty well, and the key to a successful spinal fusion is patient selection, because what we're looking for are patients that have tried lots of things, several months of physical therapy, chiropractic treatment, nonsteroidal anti-inflammatories. Some patients nowadays will undergo injections on the spine, epidural injections, nerve blocks and joint injections. And patients that have gone through those kind of things and yet still have pretty bad pain are a reasonable candidate for spinal fusion surgery.
So let's talk a little bit about what you guys do and how the surgery goes.
Sure. So what we'll do after a very thorough evaluation in the office and a history and a physical examination is obtain some imaging. And we'll look at the imaging studies and try to determine if there's a segment of their spine that the pain is coming from. And that's one of the reasons we'll send a patient for an injection, is to try to pinpoint the pain generator in their spine. And if we can identify that, then we can treat it in any number of different ways with surgery, and one of those is spinal fusion.
And I see a couple different types here.
That's exactly right. So some patients have a problem that's a single level, and the disc will be worn out, and we'll try to do a surgery where we fuse across that disc. That surgery will involve an implant into the disc space, and we prefer an implant that's made of a plastic resin. It's made to match the hardness of bone so that the bone doesn't collapse down over the implant, but it holds it open in the disc space. That implant will be filled with some bone marrow and some bone granules, or sometimes some of the patient's own bone, and then that'll be fixed together with a plate across the front with screws that go to the bone above and the bone below. And that's one way to do it. That's a surgery that we'll do in conjunction with a general surgeon that gets us the approach down to the spine, protects the major blood vessels and veins that are in the area, and gets us the access that we need. And then we'll come in, take the disc out, re-elevate the disc that's collapsed down, and replace it with the cage or the implant and the plate on the front, so that it doesn't come back out.
And I see a couple other examples here as well.
Right. This is an example where we can fuse across the back of the spine. These are called pedicle screws, and it's a screw that starts out in the back and goes through this portion of bone, which is the pedicle, and ends up down here in the vertebral body. Okay? And then that'll fix together several segments. In fact, we can do a very long segment if we need to fix a scoliosis or a very significant curvature in the spine, or we do a surgery that destabilizes the spine by taking the joints out. We can replace the mobile segments with a fusion, and in this case we do this across multiple levels with a rod that connects them.
How about downtime and on the positive side, the results? I mean,
that's a great question, and it depends an awful lot on what we do. A single level surgery like this, a patient will often stay overnight in the hospital, or perhaps a second night. In a situation like this where we have to do a major correction in a very extensive spine fusion, the patient may be in the hospital for several days to perhaps a week, and maybe go to a rehab and get intensive physical therapy before they eventually go home.
But some great success stories?
The success in all of these is excellent, depending on the patient selection and patients that have failed to respond to other things. They generally get 50% or so less spine pain.
And that's a lot.
After they're healed.
All right. Thanks so much, Doctor. Really appreciate it. Neuroscience Group in Neenah.
That's correct.
If you're having back pain, you've tried a bunch of stuff and it's not working for you, give them a call, go online, and they may be able to help you out. Appreciate it.
All right, thank you.
You betcha. Coming up, back to the kitchen. Stay with us. We'll be right back.